So to go back to making the diagnosis, even though we know that this entity occurs, the presence of double hit, where you have both the MYC rearrangement and one of those other two, is relatively uncommon, only about 5 to 7% of all unselected cases. So that's a lot of people to test by multiple FISH probes to identify a very few number of patients who have a very poor prognosis. So I talked about different screening methods that people have used to see if they could limit the number of patients who need the FISH testing, and there are different approaches. We know now that double hit lymphoma primarily occurs in people who have germinal center diffuse large B-cell lymphoma, so some have advocated using the cell of origin model to decide who needs further FISH testing, and I think that that's a very reasonable approach. Others have said, well, if you have a double hit rearrangement, you will have proteins overexpressed. And so perhaps you could look for dual expression of MYC and BCL2, and that could limit the number of people that you could test. And then there are others who have suggested looking first at a MYC rearrangement and then deciding. Today, we don't really know which one of those approaches is going to be the most cost-effective, the most rational, but I will say that one of the largest studies recently published by David Scott and colleagues in over 1,200 patients really emphasizes the point that this is a germinal center derived lymphoma, and maybe that's the group we could focus on.